Association WA President Michael Page joins me on the program. G'day, Michael. Appreciate your time this afternoon.
G'day, Paul. My pleasure.
Let's tackle that gun issue first that's come up this morning, and it's a gun owner question. What are the risks with this impending mental health check with regards to a GP flagging approvals? Maybe there's an ideological disconnect with government policy, and/or these are the people that they live and work with. Does that put a different pressure on the GP when it comes to making this assessment?
Yeah, look, it absolutely does, Paul. It is of concern that GPs are going to be asked to do these health checks, not just mental health, but a health check to, I suppose, contribute to the overall decision making by the police as to whether someone should have a firearms licence reissued. And you've hit the nail on the head there. These GPs are living and socialising in small communities with gun owners who, many of whom require those firearms for their work, farming and the like. And there is always that concern, as you said, that someone with mental health difficulties might not declare it because they're worried that their GP might view their application, might disclose that, and then they don't have their firearms license renewed or issued, and of course those issues where GPs might be concerned for their own safety in some instances, which is not to suggest that that we think firearms owners would be irresponsible, but of course that fear might be there with some individuals. So yes, it is a slightly vexed issue. I think that would be true to say.
And it's hard enough sometimes to get older regional folk in to see the GP in the first place. The other side of that is a non-disclosure, but for the example, Farmer Smith gets a diagnosis and maybe his licence isn't renewed and he doesn't have his guns. That becomes obvious to other people, right? So there would be stigma attached with that.
There may well be stigma, and I think we see this with a few things that GPs are asked to do. Another good example would be up in the Kimberley, where GPs have been asked to report problem users of alcohol to a banned drinkers register. It's a similar issue in the sense that it's asking the GP to do something that might affect that person's livelihood or their life in a way that really might undermine the therapeutic relationship between the GP and the patient. It's really important that GPs and patients are able to discuss anything with one another, that a patient can disclose anything to their doctor in the knowledge that it will only be used to assess and ultimately improve their health. If there's a suspicion from the patient that the doctor might then disclose that to some external agency, which will then impact some aspect of that patient's life, then it undermines that relationship. And that's always one of the things that we're concerned about with these sorts of programs.
Which in turn may affect the health outcome of the individual.
Absolutely right. And mental health is a big issue. And that example you give of the, for instance, farming can be a very isolating career and profession. And we know that mental health problems and suicide are big problems in farming communities, and of course firearms use is required by many farmers. So that is a good example of where this could lead to harms.
When you speak to GPs, is there a way of practically making this work? Is it a case of the right guidelines being in place?
Yeah, look, and the AMA has been contributing to the development of this legislation, which has recently come in. And we have managed to, I think, bring it to a point that's acceptable to GPs that might be involved in this process. The report written by the GP goes to the licensing authority, which then uses that information and other information to make an assessment. And it might decline a licence or it might approve a licence, but it won't disclose to the patient the report provided by the doctor. Now, that's still, that might go some way to protecting the relationship between doctor and patient, but of course there might always be that suspicion by the patient who's been declined a firearms licence that the GP undermined them in some way, and again, that will undermine trust in that relationship, which is so important.
And clearly it's a hot topic. The other one, which is an interesting one too, which I would imagine will be another hot button issue, for the want of a better way to phrase it, diagnosing conditions like ADHD. I mean, this is an incredibly complex health problem. At the moment, it's multiple appointments with specialists, and that's not only through the diagnosis phase, but also medication, getting the right medication, the balance of medication should a diagnosis be achieved. This goes on. Is this achievable for GPs in rural clinics?
Look, I think it is, Paul. This is a huge issue. Many of your listeners in regional areas where access to medical care is difficult at the best of times will have found that getting children in particular, but also adults, assessed for these sort of neuro developmental disorders, including ADHD, it's very difficult. It's difficult in the city, it's difficult in the country, but in the country it's even harder. It can take years for an assessment. Private waiting lists are extremely long. It can be expensive. So in general, I think the fact that GPs will be able to have a greater role in that assessment and treatment of ADHD is a good thing by improving access to care. There will be additional education available to GPs. I mean, look, GPs are already treating these patients and seeing these patients, referring them off to psychiatrists or paediatricians on a daily basis. So it's not as though this is completely out of the blue or new to them. But of course, a little bit of upskilling is always required for any doctor taking on any new task. So there will be some training associated with it, and of course, what we hope and expect that there will be good support available from those specialist services like paediatricians and psychiatrists to support those GPs in providing that service. So yes, it's sort of uncharted territory in Western Australia. It's a new idea, but it's been happening in Queensland for a little while, and as we understand it, with reasonable success. So
it's a working model.
Yeah.
Dr. Michael Page